And then some of the studies with exercise interventions, depression, most of them done with Dr. Trivedi. This one is in combination with Dr. Dunn. It was done at the Cooper Institute. They randomized individuals. They had two questions in this study. One was dose. They looked at a lower dose of 7 kilocalories per week, and kilocalories per week is the number of kilocalories per kilogram or body weight that's going to be completed each week. So they looked at 7 and 17 and a half. At this time, 17 and a half, that translates to about 210 minutes of moderate intensity physical activity. The recommendations at this point were most days of the week, so that'd be 30 minutes a day times 7, that'd give you your 210. And they also looked to see if frequency had an effect. It didn't matter if it was 3 days a week or 5 times a week. They exercised treadmill or stationary bike, and then did a follow-up continuation phase of 12 weeks. In this one, he was talking about control groups. They tried an exercise placebo control group. This one was they were doing stretching or yoga or just some type of easy movement, but not moderate or vigorous intensity exercise. The results from this, when they looked at frequency, they saw a decrease in HAM-D scores amongst all groups, but there was no significant changes between or differences between the groups. So the frequency they determined didn't really matter. But when they looked at the dose, they saw that while all groups showed improvement from baseline scores, the public health dose of 17.5 kkWs was more efficacious. So that's kind of leading us towards this line of a greater dose. Now I think Tracy is going to present some data next that might disagree with this, but at least at this point, that was the thought.